When I went to see my primary doctor and she was feeling my stomach, she says, your spleen is enlarged. I'm going to recommend that you go to an oncologist. So we went, and then the oncologist was giving me a complete physical. And he goes, yes, you're definitely enlarged in the spleen. And they took a blood test, and he says, you have CLL. And I go, what's that? It's leukemia. It hit me like a ton of bricks. He said, what we generally do is just watch it for a while until he took a blood test, and he says, you've got a problem. We've got to start you right now in treatment. He says, because I expect in 2 months you will be symptomatic. He says, you've had this for about 6 or 7 years. Apparently it's something that goes totally unnoticed until it's too late. And it was almost too late. I didn't think I was experiencing any symptoms at all, but my wife reminds me of how tired I used to get.
When Jim was first diagnosed with CLL, I had only been retired about 3 months, so I hadn't been home with him very much. And then all of a sudden I noticed that when he was watching TV, he was falling asleep. He just wasn't hungry like he had been. And that made me really concerned to how he was doing, because he just didn't have energy.
My doctor told me there was a clinical study with a drug called Calquence. He said it's a clinical study that has really helped people. I was really interested because it was going to help me, but I'm also interested in helping other people.
The doctor told us that he had had very good success with the treatment and that he had other patients that were doing very well on it, and he would like to see how Jim did. There was no guarantees, but this would be the first line of treatment. And so Jim took 2 pills a day and he went through the infusion.
I'm still on the pills 3 years later. My doctor did talk to me about side effects. He says, some people have experienced vomiting, some people have experienced soreness. I experienced one side effect from this whole thing. I bruise easily. It's part of the side effect of the medication. Well, since I've been on the Calquence, my life has changed completely. I didn't realize it before. I was slowing down. You don't realize when that's happening to you. But when you come out of that and you get nothing but energy, you wake up in the morning and you feel like getting up instead of staying in bed and sleeping, it's really eye-opening.
Jim being on Calquence has meant to me that we play cards and we take trips, and he has energy to go hiking. In fact, we try to get in 10,000 steps a day. We don't always make it, but we make the effort.
My message to other CLL patients is don't give up. I mean, it's no such thing as it's over. You talk to your doctor, pay attention to it, and ask questions. Look up on the internet. Find out what it is you're dealing with. Well, that's what we had to do. We had to find out what it was we were dealing with, and then take positive action.
What is Calquence? Calquence is a prescription medicine used to treat adults with chronic lymphocytic leukemia, CLL, or small lymphocytic lymphoma, SLL. It is not known if Calquence is safe and effective in children. Important safety information about Calquence, acalabrutinib capsules. Before taking Calquence, tell your healthcare provider about all of your medical conditions, including if you have had recent surgery or plan to have surgery. Your healthcare provider may stop Calquence for any planned medical, surgical, or dental procedure. Have bleeding problems. Have or had heart rhythm problems. Have an infection. Have or had liver problems, including hepatitis B virus HBV infection. Are pregnant or plan to become pregnant. Calquence may harm your unborn baby and cause problems during childbirth. Dystocia. If you are able to become pregnant, your healthcare provider may do a pregnancy test before you start treatment with Calquence. Females who are able to become pregnant should use effective birth control, contraception during treatment with Calquence and for at least 1 week after the last dose of Calquence. Are breastfeeding or plan to breastfeed. It is not known if Calquence passes into your breast milk. Do not breastfeed during treatment with Calquence and for at least 2 weeks after your final dose of Calquence. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Taking Calquence with certain other medications may affect how Calquence works and can cause side effects. Especially tell your healthcare provider if you take a blood thinner medicine. How should I take Calquence? Take Calquence exactly as your healthcare provider tells you to take it. Do not change your dose or stop taking Calquence unless your healthcare provider tells you to. Your healthcare provider may tell you to decrease your dose, temporarily stop, or completely stop taking Calquence if you develop certain side effects. Take Calquence 2 times a day, about 12 hours apart. Take Calquence with or without food. Swallow Calquence capsules whole with a glass of water. Do not open, break, or chew capsules. If you need to take an antacid medicine, take it either 2 hours before or 2 hours after you take Calquence. If you need to take certain other medicines, called acid reducers, H2 receptor blockers, take Calquence 2 hours before the acid reducer medicine. If you miss a dose of Calquence, take it as soon as you remember. If it is more than 3 hours past your usual dosing time, skip the missed dose and take your next dose of Calquence at your regularly scheduled time. Do not take an extra dose to make up for a missed dose. What are the possible side effects of Calquence? Calquence may cause serious side effects, including serious infections can happen during treatment with Calquence and may lead to death. Your healthcare provider may prescribe certain medicines if you have an increased risk of getting infections. Tell your healthcare provider right away if you have any signs or symptoms of an infection, including fever, chills, or flu-like symptoms. Bleeding problems, hemorrhage, can happen during treatment with Calquence and can be serious and may lead to death. Your risk of bleeding may increase if you are also taking a blood thinner medicine. Tell your healthcare provider if you have any signs or symptoms of bleeding, including blood in your stools or black stools, looks like tar, pink or brown urine, unexpected bleeding or bleeding that is severe or you cannot control, vomit blood or vomit that looks like coffee grounds, cough up blood or blood clots, dizziness, weakness, confusion, changes in your speech, headache that lasts a long time, or bruising or red or purple skin marks. Decrease in blood cell counts. Decreased blood counts, white blood cells, platelets, and red blood cells are common with Calquence, but can also be severe. Your healthcare provider should do blood tests to check your blood counts regularly during treatment with Calquence. Second, primary cancers. New cancers have happened in people during treatment with Calquence, including cancers of the skin or other organs. Your healthcare provider will check you for skin cancers during treatment with Calquence. Use sun protection when you are outside in sunlight. Heart rhythm problems. Atrial fibrillation and atrial flutter have happened in people treated with Calquence. Tell your healthcare provider if you have any of the following signs or symptoms: fast or irregular heartbeat, dizziness, feeling faint, chest discomfort, or shortness of breath. The most common side effects of Calquence include headache, diarrhea, muscle and joint pain, upper respiratory tract infection, and bruising. These are not all the possible side effects of Calquence. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. Please see full prescribing information, including patient information.